Video 263. Retirement healthcare budgeting, what you'll really spend on medical costs. Healthcare is consistently one of the biggest and most underestimated expenses in retirement. Even with Medicare, the out-of-pocket reality often surprises people who assumed 65 meant their medical bills were essentially solved. Building a realistic healthcare budget changes that. The pieces that add up. Even with Medicare, you're typically covering a Part B premium, possibly a Part D premium, and either Medigap premiums or Medicare Advantage cost sharing, depending on which path you chose. Add in dental, vision, and hearing costs that original Medicare largely doesn't cover, plus any prescriptions that land in a higher formulary tier, and the monthly total is often meaningfully higher than the headline Part B premium alone. Higher earners also face income-related monthly adjustment amounts, called IRMAA, which increase both Part B and Part D premiums above a certain income threshold. Building your own realistic estimate. Rather than relying on national averages, which can be misleading for your specific situation, build your estimate from your own numbers. Your actual Part B and Part D or Medicare Advantage premiums, your typical annual prescription costs, your dental and vision spending from recent years, and a buffer for the unexpected, a hospital stay, a new diagnosis, a specialist you haven't needed before. Reviewing your prior year's actual healthcare spending, if you've kept any records, is often more useful than any general estimate you'll find online. A simple framework for organizing the numbers. It helps to sort your expected healthcare spending into 3 buckets rather than one lump estimate. The first is fixed monthly costs, premiums that arrive like clockwork regardless of how much care you use. The second is predictable annual costs, routine dental cleanings, an annual eye exam, prescriptions you take regularly. The third is the unpredictable bucket, the specialist visit or minor procedure you can't foresee but should still budget a cushion for. Building your estimate in these 3 layers, rather than one combined guess, makes it far easier to spot where your actual spending is drifting from your plan during the year. Planning for the big unpredictable costs. The costs that really strain a retirement budget aren't usually the routine ones, they're the unpredictable ones. Long-term care, whether at home or in a facility, isn't covered by Medicare beyond very limited short-term situations, and it's one of the largest potential expenses retirees face. This is exactly why long-term care insurance, hybrid life insurance, and long-term care policies, or a deliberate self-funding strategy, deserve real thought well before you actually need care, not after a health crisis forces the decision. Where this fits into your overall retirement income plan. Healthcare costs generally rise as you age, even as other retirement expenses like travel and dining out often decline. A smart retirement income plan accounts for this shifting pattern rather than assuming flat spending throughout retirement. Talk with a financial advisor about building healthcare inflation into your withdrawal strategy specifically, and consider a health savings account if you had access to one before retirement as a genuinely tax-advantaged way to cover medical costs later. Funds can be withdrawn tax-free for qualified medical expenses at any age. Costs vary more by region than people expect. National averages for retirement. Healthcare spending can be genuinely misleading because both Medigap and Medicare Advantage premiums vary significantly by region, county, and even zip code, driven by local provider costs and plan competition. 2 retirees with identical health needs can face meaningfully different premiums simply based on where they live. This is one more reason to build your estimate from your own plan's actual local pricing rather than a national figure you found in an article, including this one. So as we wrap up, here's the real takeaway. Healthcare is one of the biggest expenses in retirement and one of the easiest to underestimate. Even with Medicare, premiums, prescriptions, dental and vision costs, and unpredictable medical events add up quickly. Building a realistic healthcare budget isn't about guessing, it's about using your actual numbers, organizing them into predictable and unpredictable buckets, and planning for the long-term costs that truly matter. When you understand your real healthcare spending, you protect your retirement from surprises, and you give yourself a far clearer picture of what your income needs to support. Now here's your improved call to action. Take one evening this month to build your own healthcare estimate. Pull your actual premiums, your prescription costs, your dental and vision spending, and add a cushion for the unexpected. Don't rely on national averages, rely on your real numbers. This single exercise can prevent healthcare from quietly derailing an otherwise solid retirement plan. Thanks for spending this time with me today. If this helped you feel more prepared, feel free to join me for more videos like this. And remember, a strong retirement plan isn't just about income. It's about anticipating the costs that matter most. I'll see you in the next one.